Welcome all, and thank you so much for coming to this incredible event. My name is Ronnie Finkelstein. I'm in the class of 2015, and as a member of the Grinnell Prize Advisory Committee and the Rosenfield Program Committee on International Relations, Public Affairs, and Human Rights, I am very pleased to introduce to you our 2014 Grinnell Prize winners, Adam Kircher and Kiah Williams, two of the co-founders and directors of SIRUM, supporting initiatives to redistribute unused medicine. So having been involved with the Grinnell Prize for the past 4 years, I always look forward to having our winners on campus and getting to know them as individual human beings. And Adam and Kiah are no exception. Their presence on this campus in the past few days has been incredible. Their charisma, raw intelligence, and their magnetism has really impacted every single student who they've spoken with thus far. So much of Kiah's and Adam's strength comes from the fact that they come from very different backgrounds, Kiah in healthcare management and Adam in coding and product design, and together they come to SIRUM with their co-founder George Wang to redistribute unused medication to people in need, because 1 in 4 people or adults in the United States goes every day without every day, 1 in 4 adults goes without taking medications for financial reasons, and they're working really hard and in a very innovative way to make sure that this does not happen anymore. Another thing to mention is after the talk, we're all going to head upstairs for a very lovely reception as a closing ceremony for the prize symposium, so please join us for that. And thank you, Adam and Kiah, for being here. We look forward to hearing your talk and to hearing more about SIRUM's accomplishments in the future.
Thank you for all coming out. So SIRUM really started when I was a senior and I was looking for what do I do next in my career. And I thought I wanted to do a master's in industrial engineering, looking at supply chains because I'm a geek. But I wasn't sure, and I didn't really have a passion at that point. Thankfully, I actually went on a trip to Indonesia over that summer, and I saw the island of Batam. And what would have been an uneventful, unmemorable trip actually is now ingrained in my mind. About a month after I returned, a tsunami hit the island of Batam and completely devastated many of the areas I'd seen. Not only was this devastation close to home because I saw pictures on the news of exactly the places I had just visited, but because the relief effort was being botched. Life-saving medications weren't getting to those in need. People were dying because they couldn't get the medicines that they needed. And it reminds me of a newspaper article I saw where I saw life-saving medications taking 9 months to get to those in need, and FedEx resumed overnight shipments to Indonesia. And I love my Amazon shipments getting here to places on time, and I get very frustrated, as Kiah knows, when they get delayed. But relative to someone's life, it seemed trivial. So I came back, and I had what I knew was going to be my master's thesis. I took a very academic stance, and I studied the medicine supply chain for relief efforts. And my conclusion was that we needed to have a peer-to-peer system to actually enable medicine donations to get to where they are needed. And through a peer-to-peer system, we could get a 9-month donation supply chain to one that's only a matter of days. But my ambition didn't kind of end there. I started a student group, and I had taken some business classes, so I started getting a big head, and I was like, I could really create something here. So I grew it to 40 students, and we had different project teams managing different aspects of the organization. And I created a little website so that people could go on and find out more about it. I had a 40-page business plan that I iterated on 20 times. I have those still on my hard drive if anyone wants to look. I did everything. Oh, I tried to incorporate and looked into incorporation. I did everything except actually make a medicine donation. And several years later, it kind of dawned on me, it's like, wow, I feel like I've accomplished a lot, but this is actually quite dysfunctional. I've had 40 students working for over a year and what have we accomplished? It looked good on paper, it looked good on my resume, but it hadn't actually helped anyone. So I knew at that moment that I was not the person, as much as I wanted to be, to lead SIRUM to the next level. I was fortunate enough to be able to find a co-founder, George Wong, a scientist who was doing his postdoc at Stanford, and he knew he didn't want to do science, so I was able to sway him in order to join SIRUM and try to use his pipetting skills to actually enable donations. With him on the operations side, I also knew that we needed someone who actually knew how to grow a business, not someone who had just taken classes like me. I had met Kiah my junior year, and Kiah had blown me away because right out of college she had a Tom Ford Fellowship in Philanthropy and had gone to the Clinton Foundation and almost single-handedly had grown that into a national initiative with national insurers, Fortune 500 companies. And I knew that if I could convince her to join SIRUM, that we would really have the most amazing team I had ever built. So I told Kiah, quit your job at the Clinton Foundation and join me. I don't have funding right now, but I'm sure you'll be able to get some. And then to my surprise, she said no. So I'll let her tell her side of the story and why that happened.
So I want to give a brief shout out to George, who I know is watching via live stream. So as you can see, I am Kiah, this is Adam, and that's George. And we do all kinds of cutesy poses like this on a regular basis, especially during the early years. Maybe that's why we got a little less done initially. So I'm not really supposed to be here in a lot of ways. I was what we would call a reluctant entrepreneur, and you can see my side eye to Adam indicating. So for me, it was a lot of learning and growth around how did I value prestige, and ultimately how comfortable was I going out into the unknown. So talking about prestige, I had an incredible job, incredible opportunity at a national and globally recognized nonprofit that was known for innovation and changing the world at former President Clinton's foundation. And I loved the work that we were doing there. As a recent college grad, you start to think about how prestige matters, what kind of stamps you want of your resume, and that really can impact some of your decisions. On a personal note for me, I also had a lot of concerns around who was going to pay, my student loans if I went off and did something new. And, what would happen to me personally if we didn't get funding. A lot of real-world concerns just around my own personal safety net and how much was I willing to risk for this. Ultimately, I think we all come to a little bit of crossroads on this where you have to start deciding how you're going to live your life. And for me, I said to myself, I think I want to start something at some point. I really like these people. I think that this is a great idea. If not now, then when? Yes, I had some student loans, yes, I wasn't in the best financial situation, but at the same time, and I think to Adam's convincing point, he kind of constantly reminded me, this is the only time where in our lives where we could have the lowest amount of debt. I don't have a mortgage. I don't have children. I don't have as much financial responsibility as I hope to have someday in the future. When else could I take a leap like this? And ultimately, I decided to take a leap with those two crazy guys. And so we really started building. I think one of the lessons learned from having kind of an unwielding, huge organization up front was that you don't need a lot of people to get something done. It's better to have a small group of people doing a lot of work than a lot of people doing a little bit of work, right? And I'm sure many students can attest to being in that student group that, you're just meeting hour after hour, and for some reason, nothing gets done. And you're wondering, you come back from that meeting, you're like, what did we do for the last 2 hours besides eat some cookies? And so, we kind of scaled back and said, who's in this for real? Who's going to help us get one donor and one clinic? Because in a lot of ways, it really just starts with one, especially when you're kind of a ragtag, bootstrapping it group of people who doesn't admittedly know that much about the space, but has kind of some kooky ideas. You got to start somewhere. And so in a lot of ways, what we ended up doing was, asking local professors, asking anyone in our social networks who knew anything about this field to just share and educate us about the space. And then we did what the business world fabulously calls business development, which sounds like a super cool thing, which ends up oftentimes being a lot of cold calling. And just trying to get, calling 100 places, 100 hospitals, nursing homes, manufacturers, and just trying to get one of them to have a phone call with us to learn more about this process. And so we really just focused on, finding that one donor in one clinic that was actually willing to kind of work with us and see if we could take this surplus medicine and get it to those clinics in need for their patients. And we finally found one. We had one donor in one clinic and made that just one donation happen on a lot of sweat equity. And so what we started to realize, though, is after that first donation, is that there's actually about $5 billion of drugs going to waste every year in the United States. So we did one donation of medicine worth, a couple $1,000s, but there was $5 billion. All of a sudden, this idea started having some legs. Beyond just this one, kind of exercise of us doing it nights and weekends. And at the same time, 50 million people are skipping prescription drugs due to cost. That's 1 in 4 working age adults in the United States. Some have insurance, some don't, but ultimately that's just a huge number of people. And so we knew that this idea had some legs. We knew that if we could do one donation, why couldn't we do 1,000? Why couldn't we do 100,000? And so we really started thinking, okay, this has something, there's something here. There's something we can do with this. And so we started really just bootstrapping more. And if you're curious what bootstrapping an organization looks like, it looks something like this. So we literally spent nights and weekends working remotely. Sometimes we would drive into the Starbucks. That became our office space so that we could have conference calls from freeconferencecall.com so that we could start actually creating this business. And for example, George, who was finishing a postdoc, this meant pipetting, setting up an experiment, then going to a meeting down the road at the local hospital or local clinic, then coming back and checking on his experiments. It was really us all putting in a lot of time, nights, weekends, off hours, lunch periods, to really figure out, could we make this happen besides this one time?
And bootstrapping is a deadly euphemism. So as Kiah pointed out, it sounds sexy until you live it. And it was a huge leap of faith. We had made that donation. We knew there was legs, but we had good jobs. I had gone from McKinsey to Harvard Business School, and I was in the middle of my first semester. Kiah was at the Clinton Foundation, growing a national initiative. George had wonderful prospects, both in the academic sector and in the private sector after his PhD program. And so we were a little bit crazy to drop out of all those stable jobs right in the middle of the recession. But we don't regret it, and I think it's because our motivations were the right ones. It's easy to want to become an entrepreneur because you envision yourself as the Mark Zuckerberg or the Kevin Systrom. It's easy to see yourself in those positions and think, hey, that's what I want to do. But the true motivation to be an entrepreneur is to want to do that work, even if it doesn't work out. And that's when all three of us knew that we wanted to do this idea, was because even if it wasn't successful, even if SIRUM never made it and we weren't able to scale the program, we still wanted to do it. So we dropped out during the recession, took a fifth of our salary around for the first time. Kiah got on a phone call with our first major funder before we knew they were our first major funder, and they said, oh yeah, we'll do a small planning grant. You can do a business plan. You can build a web page. And I was like, oh no. So Kiah, in the middle of this call, I'm like, you know, don't agree to that. So Kiah was like, well, 20,000 would be great, but how about 150,000? It was the most awkward pause I think we've had. And, I don't know, everyone felt uncomfortable in that call. But they said yes. And now we're here today. So now I get to tell you about my second big mistake. So now we have full-time funding. I've dropped out. You know, I've learned my lesson. Small committed group. Get the right team. Get them on board. Let's start building out this product. So I'm a programmer. Let's do some cool stuff. So I built a barcode scanner, a mobile application, a lot of features for the donor so that they could log in requests and log in supply. Nice little iPad interface. I was building all of this in a box. We had one donor, and I kind of took it. I was like, oh, well, they must be representative of donors as a whole. Oh, everyone must love cool new technology and iPads and iPhones and barcode scanners. And boy, was I wrong. Not one of those features is in our product today. So that was another wasted year of my time. But the learning from that, I think, was substantial. That it wasn't about what I thought was cool. It was what our users thought were cool. And an N of 1 does not a user's make.
Yeah, I think in a lot of ways what we really learned is, although we loved technology, we thought it has an awesome power to make things happen more efficiently. Technology is but a tool oftentimes to help people in real life. We were essentially trying to deal with real products, you know, real medicine. And so obviously this is going to involve real people, be it the nurse or a pharmacist who's packaging a donation, or be it the pharmacist on the receiving clinic side who's opening that medicine and shelving it, or down to even the patient who's receiving the medication donation through the program. And so technology is a tool oftentimes to enable people to do something in real life, or IRL for the young folks. And so we really had to get out there and actually start shadowing people and understanding who are our users. Because it wasn't me. This was actually one of our first donor organizations, and our first donor, Dean Kircher, who's a nurse, who was saying things to us like, you look at all this medication and you know it's useful to somebody. We had to really get out there and actually understand the people that we were hoping to have as users, be they medicine donors or the clinics that we were serving on the receiving side. So I think, you know, we came into the process with probably a little bit too much technology solves everything, and a little bit of hubris in that respect. And what we had to do was really figure out, okay, we think that technology ultimately can be a real tool to help us scale efficiently. But at the core, we had to really understand our users, who we were building these products for, and what they needed and what they wanted. Because, you know, in 2010, 2011, not everyone had an iPhone. So us building a product that looked really cool on the iPhone was not necessarily our target demographic. And so, you know, that took a lot for us to kind of change that thinking in order to grow. And so we said, okay, now we've got the right solution. We understand our users. We've shadowed them. We're working with these nurses. We're working with these pharmacists. We understand the complexities and the challenges that they have in their daily life and how they want to interact with the computer and how they may want to interact with something like their fax machine, which still exists in a lot of healthcare settings and is still used to this very day. And so we had to figure out, okay, how are we going to interact with the fax? How are we going to take paper and digitize it? These are the things that we started to do. And we said, aha, now we've got the solution. Now we're ready to blow it out of the water. Except there was this one little problem. We started shopping this idea out and said, yes, there are laws that protect drug donation in the state of California. Here it is on a piece of paper. Here's our booklet. Here's our brochure. You should work with us. We understand you. We've got a facts-based paper option for everyone, if that's what you desire. And then we started talking to a couple of nurses and they said, no, like, look, right here in this book here, this says I can't donate medicine. But we said, but this other law right here says that you can, and it was written afterwards, so that should matter. They're like, no, that's not gonna work for us. There's a conflicting law. In times like this, you realize that a lot of entrepreneurship, a lot of starting a new venture is managing your own psychology. So how do you deal with the fact that you've figured out, you've overcome a lot of these obstacles, you feel like you have the right product, and then you literally just want to bang your head against a wall because you can't get anyone to donate now because there's some random conflicting statutory code in this subsection and it doesn't match this other subsection across in the health and safety code. So what do you do in that situation? A lot of it is, first of all, having an amazing team around you who you can kind of sit in a room and close the door and turn off your phones and just kind of scream and lament at the fact that how terrible and how stupid this is. And I think that was really important to learn. How do you deal with stress? What level of discomfort are you okay with? How long are we able to hold on to this? How do we keep on pushing forward? We were fortunate that I think that in our co-founder, George, who we realized apparently completing a PhD can oftentimes be a very solitary activity. And oftentimes you have to celebrate a lot of the small victories because you essentially spend many, many years trying to make breakthrough discoveries, especially in the sciences. And I think it was to George's credit that he said, hey guys, we just got to celebrate the small victories. And he has this saying that we now have kind of blasted across our front board, which is, motivation follows motion, not the other way around. George said, we just got to keep on pushing through, guys. We got to contact the regulatory bodies, contact everyone at the state level, contact counties, and just slowly chip away at this. And I think much to George's credit, because I was ready to literally like put my head through a wall, he just kept on trying to move and talk to this person who then could refer us to their manager, who could then refer us to their supervisor, who then could refer us to the vice president, and kind of this slow push forward. And we finally broke through a wall. And we were able to work and get, in a fairly quick time, not quick enough for us, I think internally, but we were able to push forward and actually get this kind of legal hurdle, this miscommunication between two subsections of the law clarified. And then we finally had something. We finally had a product that addressed all of the users that we were looking to work with. We had the right technology, not forcing technology on people where it didn't need to be. And we had this legal framework now all clarified that would enable us to do work. And so finally, we felt like we figured it out. And this is kind of some of the stories that we heard from folks like Dean. I'll share a brief video on what we were able to start generating from the community, what stories we started hearing.
I do this work because I've always wanted to make a difference in people's lives. My work is very rewarding. It's a spiritual thing to me. People say, oh, how can you work in a nursing home? It's so depressing. But I feel so connected spiritually when I assist a resident make their final journey. There's unused drugs in skilled nursing facilities because of the amount of medications we have delivered. We get a 30-day supply for each resident, for each medication they take. We can't send it back to the pharmacy. It's just such a waste. You look at all this medication and you know it's useful to somebody, and here we are shipping it off to have it incinerated. SIRUM has made it possible for us to donate medications rather than having them destroyed. We can enter the medications that we have available on a website, and clinics in the area can request those medications for their low-income patients. They've come to the facility, helped us enter the medications on the website, and even come and helped us ship off the medication. If we could apply SIRUM on a much larger scale there would be much less waste, much less abuse of the environment because we're not incinerating all of these medications. It would even save taxpayers money because Medicare and federally funded prescription plans are what's paying for the majority of these medications. We have 59 residents here, and we already know we're making a difference in their lives. Now we're making a difference in the lives of so many more people because we're providing them with the medications that they need that they otherwise wouldn't be able to get.
So those are the stories we started hearing, and we heard that from Dean, and then we heard that from 10 more donors, and then we heard that from 20 more donors. And then we had this realization, so, you know, obviously we're growing, we're building this company, and I think within the first couple years, one of the key revelations that we had was that you have to have a ruthless prioritization when you're building a company. As we started gaining traction, we had a lot of interest from, and I'll name a couple examples, industries like there was an oil company who wanted to use our website to help them move and understand where they might have surplus drill bits on one part of the globe and connect it with new oil rigging sites in another part of the globe. We had other countries who were interested in our work and having us potentially move there. And we were like, I don't know anything about the healthcare system there. I don't know anything about the laws there. We're just getting a handle on the ones in our own country. So, you know, we had that happen. We also had folks who wanted us, you know, be it funders or other NGOs who wanted us to focus on medical supplies or wanted us to focus on over-the-counter drugs. So we started this one program focusing on prescriptions, and then all of a sudden, as we started gaining a little bit more traction, you know, there was a huge potential for mission creep. And so we realized, and some of those roads we kind of started down, and I think that might have derailed us a little bit for a short amount of times. But we really realized that ruthless prioritization and sticking to your kind of core competencies and mission statement were what ultimately drive us forward. And that's what really helped us kind of stay on track and see the growth that we were hoping to make.
So after 2 failures, our third try, we finally had something. And the years and the effort and the blood, sweat, and tears were all worth it once we heard people like Dean tell their story. We quickly grew to about 200 donors in California, distributing about 1 million pills, thousands of donations, having a huge environmental impact. But we still wanted to grow larger. We thought of SIRUM almost like the recycling program back in the 70s. You can have this trash can and then give someone a new bin that they're unsure what it does. And now that we have 5 bins and we have to sort everything, it seems so common sense. But imagine being back in the 70s, seeing that recycling bin for the first time. And imagine how silly it seems. Before I could just throw everything away in this one. Why do I have to now pick and choose what goes in where? And what do you mean only cans go into this other one? But there is the mindset shift. And now recycling is the rule rather than exception. And almost everyone does it. And if we're recycling 5-cent Coke cans, why can't we recycle $100 medications? So with that in mind, our California model had grown successful. And then other states, such as Colorado, soon became interested. So we started a pilot there. And we grew even faster than we had in California. And now, to expand on the national vision, we are about to start a pilot program in Oregon. So we really want to see SIRUM grow into a national program where every single pill that it goes unused is going to someone who needs it.
And, you know, we want to take this opportunity. We're at Grinnell College, where, you know, you have an illustrious alumni, Robert Noyce, whose work essentially spawned innovation within Silicon Valley and made it what it was. And, you know, a lot of our work is, number one, we're based in Silicon Valley. And number two, we focus a lot on technology and how we can utilize it to affect larger change. And it was people like Robert Noyce who, essentially made that work possible and continue to make that work possible. We are really an application of technology for real-world problems, much like our co-winners at Sanergy. And we really feel like the Grinnell Prize really provides us an opportunity to be here at Grinnell and again lean on some of those resources and time and talent of the community here once again. We really see ourselves in the students here and in the community here. Over the past week, we've just seen an incredible spirit for service and a spirit for giving back and spirit of innovation. And so we hope to leverage that as we begin to start working to achieve our national vision. So we hope that we'll get a chance to talk to folks a little later on at the reception. And thank you so much to Grinnell College for this amazing opportunity and for supporting our work. Thank you.